I always say there are a lot of emotions that I can take good care of in my office: grief, anger, denial. Guilt is a tough one, right? Because I know that I can't eliminate guilt for my patients. I can help them swallow it, I can help them understand it, I can help them live with it if they're going to want to live with it. But I do hear frequently that I gave this to my child. There are many genetic conditions that members of the couple find out that they're carriers for, and they hit that 1 in 4 chance that their child is affected with that condition. And there are other conditions that a parent has that condition, and there's a 50% chance that their child inherits that condition. And sometimes what happens in those situations is that the child is diagnosed before the parent. And so the child presents with a more severe presentation of this dominant condition, and then lo and behold, one of the parents has it, and that one member of the couple has that guilt. And so you really can't erase guilt for somebody, but you can comfort them and help them understand it. I tell everybody that each of us carries 3 or 4 non-working genes. Some of us find out what those are, some of us never know. Our genetics is unpredictable. Our genetics is not causatory. We can't cause this for our children. We can't prevent it. Our reproductive capabilities and futures are undeterminable when we get married or when we decide to reproduce, and all of this is out of our hands. And so I tell people that we can be guilty for things that we had control over. Can you really justify guilt in a situation where the randomness of it and the odds of it played out? I talk about these kinds of things. Whether or not it helps or comforts or everyone can take that or leave that, I don't know. But I don't love it when people sit with guilt, because guilt can become destructive. I tell people that I don't want one loss to cause another loss. And I think being told that you carry something or you wear something or you have this and you gave it to your child instills some level of guilt. And that while one can work really hard to tell them that you had no control and it was random and you gave that chromosome and not this one, you carry it. And so this silent capability that you have, if you're the type of person that can feel guilt or wear guilt, then that feeling comes upon you. I sometimes think that we are who we are, and past experiences in our life influence the way we deal with something in our present or in our future. And I think sometimes what you see with people that feel guilt is that they might have felt guilt for something else earlier in their life. And so this tends to be a pattern in the patients that I am taking care of now in my private practice, and that some people need a little bit more taking care of given past experiences.